kale nga n'akasente k'oba osonzeewo ggwe nga ggwe akagenda okukuyambako mu bizibu byo nga weekanga okawadde abasirikale. Naye okuva ffe ghetto structure we yayimirirawo ebintu bingi byakyuka. Abaana baffe tebakyabakwata nnyo okuggyako abo abamenyi b'amateeka. Ne be bakutte nga babakwatidde mu ghetto nga ekikwekweto kibadde kiyise. Nabo tulina omukisa ogugenda okubajjayo. Abasirikale batuwulira. Abasirikale batuwulira. Toyinza kugenda ku poliisi n'ogamba DPC nti bakutte omwana wange ng'akumanyi nti oli komanda. N'atateekayo nnyo maanyi kukola ki? Kumugjayo. Ne neebaza bakama baffe Jeno Damulira, Afande Kuteesa, nange tweyanzizza nnyo mukoze ky'amaanyi, bo bakoze ky'amaanyi nnyo tuteekateeka. Kuba bwe twamala okuyingira ghetto structure ne batuteekerawo n'essako ne certificate twazifuna. Kati bwe batteekerawo ssako eyo era muzeeyi n'amala n'atuukiriza kye yatugamba n'atuteekeramu ssente. Era kati eno essaawa gye tuliko tuwola abaana, tuwola ba ghetto youth ababadde balina bizinesi zaabwe naye nga zibulamu ebyokkola. Tugenda tubawa okutwaliza wamu katuli bulungi, tetuli bubi nnyo, era twebaliza ddala President Museveni okutukolera ekintu ekyo kuba mu butuufu twali bulungi.
Ghetto structure okusooka ffe twali twepima nga ghetto structure tenabeerawo, bali batugoba nga bintu si byakubeera nga tusobola okumiitinga, mwali temusobola na kutumiitinga. Batulaga bagenda tulondesa obukulembeze, ne batulaga nti tulina okweteekateeka, ne batulaga nti mu bayamba mulina okubeera n'essako. Era essaawa zino eno n'akasente tukayina mwe kali mu ofiisi tukakozesa ba beneficiaries abantu ab'omu ghetto wansi. Tuyanziza nnyo His Excellency the President of Uganda, Brigadier General Damulira, Major Emma Kuteesa, House Controller, anti-ghetto, tumuyita anti-ghetto. Structure kati mulimu nze nagufuula mulimu. Office eno ghetto structure mulimu kati gwenkola. Sikyalina kyenkola kyonna. Banaye ba ghetto youth mwenna bakubiriza ghetto structure yazze n'emikono ebiri ebeere ng'etuyambako oba ng'etujjayo yonna gye tuli ng'etusupportinga mu buli kimu. Veeyo akasente mwe kali mu ofiisi ak'okwekulaakulanya mutuukire ofiisi, ensonga zammwe zonna zigenda kukolebwako.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Good morning, Uganda. This is Good Morning Uganda Extra. My name is Julie F. Nantawa. Thank you so much for choosing to watch UBC TV this morning. And this morning we have a very interesting conversation. Now, to be part of it, because each one of us in one way or the other has related with it, please be part of this conversation. 0709602592. It's a WhatsApp number to which you can text by WhatsApp, and we'll be able to respond effectively. Share your opinion as well, and all of us have to enjoy. Let's enjoy this conversation. Now, it's a culture here in Uganda, and I would assume for most African countries that there are remedies that are used or were used in matters health way before science made sense for us in school. For many of our older folks, this is what preserved them, then that is herbal medicine. But in this day and age, science says that herbal medicines have side effects. So this morning, let's focus more on the dangers of using herbal medicine, especially for pregnant women. And to have this conversation with us is Dr. Namagembe Imelda and Sister Twino Muhanji Salfin, who are both from the Mulago Specialized Women and Neonatal Hospital. Once again, good morning, and thank you so much for watching the show. Good morning, Sister Twino Muhanji.
Good morning, Madam. I'm happy to be with you this morning.
Right.
Again, my name's Twino Muhanji Salfin, a senior midwife in Mulago Specialized Women and Neonatal Hospital. Having served long, I'm happy to be here to share with you about the dangers of the use of local herbs during pregnancy, labor, and afterwards. So we shall engage ourselves in this discussion. I thank you for choosing Women's Hospital and entrusting our care in you. And we are here to share with you the dangers of using local herbs. Thank you very much, Madam, for hosting us.
All right. Thank you very much. And Sister Twino Mjisha's immediate neighbor is, pardon me, Sister Twino Muhanji's immediate neighbor is Dr. Namagembe Imelda, who is as well from the Mulago Specialized Women and Neonatal Hospital. Good morning, Dr. Namagembe.
Good morning. Good morning, our moderator. And like what you said, I'm Imelda Namagembe. I'm a senior consultant from Mulago Specialized Women and Neonatal Hospital. Happy to be here. Thank you for organizing this. Thank you for this social corporate responsibility from this side. We do appreciate. We know it's quite costly, but we thank God for this opportunity to share with the viewers, talk listeners who are out there, to listen to us, this interesting conversation related to discussing this issue during pregnancy and more so during the time of labor. So the conversation will go on.
Indeed, and as you say, it's a very interesting conversation. It is indeed. So for purposes of base and introduction, I'll start with Dr. Namagembe, for you to just tell us what services are offered at the Mulago Specialized Women and Neonatal Hospital.
Thank you so much. Did you say Juliet?
Yes, Juliet.
There are a cascade of services that are offered at Mulago Specialized Women Neonatal Hospital. Some people, to ease the talk, since our name is quite lengthy,
yes,
some people talk about it as Mulago Owabachala Nabana, to keep it simple. But otherwise, regarding services, we have a range of services. We take care of the pregnant women, that is providing antenatal services and providing the delivery services for those people. And then we do take care of the newborn babies, newborn in the sense that those have just been born. Those who develop complications go to a place we call NICU, which is Neonatal Intensive Care Unit. We also provide intensive care services for the adults. And then we do provide gynecological services, that is women who are not pregnant but have come over with other reproductive related health complications. We do offer, there's a department for reproductive endocrinology and infertility, women who have suffered those challenges related to difficulties in conception, or they've ever conceived and later on they fail, so they are offered services. And we are happy to share that at least Mulago Specialized Women and Neonatal Hospital is among the places, the institutions that are offering in vitro IVF services, which is good. And then we do have also services in the area of cancer service provision, oncology, gynecology. In other words, when there are cancers which are related to the reproductive tract, we have a group of oncologists who offer services, and they closely link up and work together hand in hand with Uganda Cancer Institute. And in addition, we do offer immunization services. We do offer infection prevention services as a cross-cutting issue. And a number of other services depending on what is happening. Physicians, do we have a visiting physician who offers services to other people who are not pregnant but have other conditions like hypertensive conditions or diabetes. There are special clinics, but I may not complete the entire list, or I could have skipped. Just pardon me just in case I've skipped one of the services. But otherwise, one is free to come over to Mulago Specialized Women's Hospital. There's a customer care service on ground floor. They can really take you through through, and there's a board just over there to show you the various services which are offered at the institution. People, you are very welcome. It's a government institution and ready to welcome you all. Yeah.
Thank you very much, Dr. Namagembe, for that detailed introduction as to the services that are offered at the Mulago Specialized Women and Neonatal Hospital. Did you even know that it offers that plethora of services? For many a times, because it's a women's hospital, you only stop at giving birth and you're there. But it's good that you also get the opportunity to learn that there's more offered and more services that you can go get yourself served at the Mulago Specialized Women and Neonatal Hospital. Now, the conversation of today is dangers of using herbal medicines during pregnancies. And I'll head over to you, Sister Twinom Hanji, pardon me. You will forgive me indeed. Sister Twinom Hanji, what is your experience with pregnant women who use herbal medicine?
Thank you very much, Madam Juliet, for this opportunity. My experience, I have served in the hospital setting for now over 25 years as a midwife. So I've interacted with many mothers across the country. The experience I have is that, yes, we don't stop the mothers from using local herbs. However, we express the dangers we have encountered as we look after these moms. And as a midwife, my aim is to have a good mother who is coming out of labor and a baby bouncing and the whole family is very happy. But what are we looking at now? During antenatal, when we encounter these moms that have used local herbs, they have complications. One, the babies they are carrying can fail to grow well, and that is what we call intrauterine growth restriction. And the baby that should be delivered at 3 kilograms, we see it at 2.4 kilograms. And then when we interrogate further, we find that she used local herbs, which is not well.
By the baby, you mean the fetus, the
fetus,
unborn baby? The
unborn baby grows slowly and gives us raw weight, and it has its effect after birth. So others also, their babies go ahead to die in utero. The babies don't grow and they die. And when you again take the history well, you find that she has used a variety of local herbs, which is not good really. So others even come to 9 months, come to labor, we find no baby alive. Or we find the baby is very tired at arrival. We say, yeah, you are from home. What is happening? This baby, have you been sick? No. But when you again go further to ask, she has used a variety of drugs. And remember, these drugs don't have dosages. We don't know the constitution of it, the composition of the drugs. So they just take. So as we see that one, it's so stressing also to the family. And again, to us, the caretakers, we don't feel good when we have a mother we have catered for 9 months down the road, and then at the end of it all, we have a bad outcome. So what happens in labor? I work in specialized women in silver suits, where I have a variety of mothers delivering, and I have worked in labor suit for long. So when they come in labor, we begin. The baby's heart is very good, and we examine the mother, we see, yeah, you're going to have a normal delivery. But along the way, we find that the baby's heart is changing. It's going down. What is happening? These mothers are very tricky. They come with those rock herbs and mix them in tea, and you will never know that this tea has dangerous substance. So until you see the changes in the baby's heart or the changes in those labor pains, contraction, because we have a normal range and we see more than this is too high. So we begin asking. Some of them declare, say, my parent gave me this kawan, I'm chewing it. My parents gave me this, I'm putting it in what? In tea. So if we interject at that point, and then we resuscitate, and then we shall have a normal delivery. But unfortunately, sometimes we don't get that one out. And when we don't get out, that's when we declare these mothers, sanction them for cesarean section, and yet they would have delivered normally, for sure. but then going to Caesar and yet you would have a normal delivery has its own implications, even in the cost. It's not cost effective because the normal delivery is cheaper compared to the Caesar. This baby that we are delivering, this baby who was telling us that I'm not happy, the baby is complaining, the fetal heart is going down because of the herbs that the mother is taking, which we don't know ourselves. And then this baby is born and is taken to NICU, neonate intensive care unit. That is a cost itself. That is a long stay in the hospital. And yet if this mother had kept in the guideline of the health workers who have talked to her during antenatal, the dangers we usually give health education talks down there. And when they come to the labor ward, again we insist, but they cannot reveal. So if you comply, if the mothers do comply, we cannot get those complications. We would see the baby is born, the mother's happy, and the medical personnel, the whole team very happy, because our target in the hospital is in the best hands. We believe the mothers who come to us are in the best hands, and our hands are always best. So we don't want bad outcomes to come out of our best hands.
Interesting.
Thank you very much. Yeah.
Interesting. Sister Tunomhanji, you say that because now one would argue that from before medicine or science was very evident in Uganda, our grandmothers or their mothers or the older folks gave birth using this medicine. What changed?
So what changed, we don't know what changed, but these herbs have also made wonders for other mothers. So we are saying out of 10, we can get 2 that get complications. The uterus ruptures, damaged. The babies die, the babies get tired, but others take them and come out well. But we don't want to have that risk. We are saying we are not stopping them today, but we're saying we can yet use judgment as mothers that why, if I'm in the best hands of the medical personnel, midwife, doctors, and they're saying don't take, and if I don't take, I come out with a very good outcome, I'm just emphasizing that to the public outside there, that we adhere to the instructions of the doctors, the midwives, so that we don't go by our ancestors, our mothers, our grandfathers, our grandmothers, who used them and they survived. Maybe they got complications unnoticed, they passed unnoticed, and then for us here we are saying they used them. But we are here to say from experience we have got those complications, and if we can avoid them, kindly the public, bear with us and withdraw the herbs.
Right, and if I'm to stay with you just again, still on the issue of using them now and using them rather before, is there a conclusive evidence showing that indeed these complications have come from using these herbs, or perhaps there could have been any other complications that are not related or connected to the herbs? Yeah,
thank you very much, Madam Juliet. When you see us here today, it means we have evidence, and it is becoming a concern in the hospital, and I believe it's a concern outside there in other hospitals. In Mulago Specialized, we have registered like not less than 5 cases where we have got aggravated complications. The mother loses the uterus, and really when you sit, you have a family conference after that incident, we say exactly what happened. You came okay, or you came with those hypertonic, those very many contractions in 1 minute that cannot give your uterus space to breathe. So what happened exactly? Even the husband comes out and says, actually, my wife has been taking them for 2 weeks back. He takes them, the pains come, then he relaxes, then he takes them. So we really get that evidence. They really tell us that they have used them. Other babies also have been tired in the uterus when we are laboring. So because you have monitors monitoring, we monitor, but at one point we sit fetal heart changing. Remember, when that uterus contracts too much beyond normal, the baby is compromised. The supply to the baby, blood supply to the baby, oxygen supply is cut off, and then the baby begins complaining. So when we sit with the mother again, tell us the truth. You know, we usually sweet talk them, and then we tell them also we know, and we use politics to make sure that they understand and they comply with us. They say, actually, one is in the bag. Actually, I've been chewing it throughout the night. Now, even now, in labor, I have it. I've mixed some in the tea. And then when we open the flask, we find the real herbs there. So we have evidence. By the time we come here, it means it is a problem, and we want it calm down so that we have good outcomes.
Yes, thank you very much. If you're just joining the conversation, we are looking at the dangers of using herbal medicine during pregnancies. And in studio with us is Sister Twinom Hanji Salfin and Dr. Namagembe Imelda, both from Mulago Specialized Women and Neonatal Hospital. 0709-602-592 is the WhatsApp number that you should engage and be part of this conversation. Dr. Namagembe, how common are herbal medicines use amongst expectant mothers from the vantage of a medical vantage? How common have you noticed this trend?
Well, thank you so much. I may not have the exact statistics, but when the few that we've interacted with, apparently many women do use them. But a number of them don't talk about it. Many don't talk about it that I'm using it, except when things go wrong. Regarding the proportion out of 10, I can say that there are times when you find that maybe 4 out of 10, they may report that they've actually used them. And people use them at various stages. A number use them because even locally, like you've already shared, a number of mothers, they start at times maybe herbs to wash the body, to bathe. I usually don't have any trouble with that one. And but my major concern is usually with the concoctions, because usually it's more than one type.
There are those that
and nobody knows that
for
dose.
Smoking to help the woman.
Those ones, and some of them are put in the private part, where the birth canal.
To smoke, yeah.
All I can comment on is what we've seen, especially during the time of labor. During the time of labor, at times you can visit a mother, and you realize that contractions are still mild. Then all of a sudden, a few minutes later, when you tell the mother, okay, let's hold on, walk around, do this, do that, all of a sudden, for some mothers, you find that all of a sudden the contractions are getting so strong. You know, labor progress varies with people. So some mothers become anxious, especially in institutions where there is payment. Because when there's a dollar sign attached to every day you stay, there's a charge every day you stay. So some people get anxious, especially when those labor pains delay. So they get advice that, you know, try this. I tried it, it worked. Like what the senior midwife has said. Of course, some people have used it with good results. But this conversation is actually moving from the angle of what we call maternal and perinatal day surveillance and response, whereby when we lose some mothers, or when they get severe complications, or even lose babies and they get complications, and then as we try to investigate, go further to look at the details, what exactly happened, we realize that you find that there is a herbal medication somewhere for a number of them. And that's why we are saying that what can we do? One of the things we can do is to give feedback to the community. And so we do appreciate UBC for this opportunity. So dear listeners, dear viewers, we are giving you feedback based on what we found from some of the reviews that we've conducted. The babies who are born and become severely asphyxiated, in other words, they became so tired and we could not readily explain. Then at times as you check their mugs or their flasks, you find their unique herbs that have been in there. And then you say this child got so tired and we cannot explain it. At one stage the heartbeat was okay. Then all of a sudden the contraction was so strong. Some mothers have ruptured to the extent, like what she has said, the uterus has been removed, we've lost some lives. So because of that, since there's nowhere you can go and say, let me purchase the life of a baby, let me purchase the life of a mother once we lose one mother because of a certain complication, where we can have a preventive strategy, then we say we need to do something.
Right.
So dear viewers, we are here to inform you. Many mothers are using them. We may not have the exact statistics, but even when you Google and search out what are some of the complications related to alternative medications or herbal use during pregnancy and delivery, there is evidence there showing research has been done that actually a number of these people have suffered complications. Some of them have suffered permanent life disabilities, like when you remove a woman's uterus, yet the intention was not to do so. Some of these herbs are unique, that apparently they may cause the woman to continuously bleed after delivery. Some of them are so unique, they make the private part, when the baby passes, you can think that maybe they brought razor blade to just cut. You know, they sustain multiple cuts under the disguise that they're softening the various parts. Softened, that some mothers actually bleed excessively and they die. And yet one of the major causes of our maternal death is excessive bleeding. So, dear viewers, we are saying just as much as many women have taken their herbs and they can actually come out and say this and this helped me, but like what we say, even the artificial medication or the medicines which we say dagali abazungu, even it is not 100% safe. Whatever is used and there are certain doses beyond, it becomes dangerous. My advice, when you come to labor, it is safer you don't take those concoctions. The challenge is, there are times when actually we may need to strengthen the labor contraction. But because these drugs have been calculated and the doses we know, if someone behind there is using something else and we are not aware, and in addition then we bring this other one on board, in the long run it can end up being an overdose and we'll get complications. So we are sharing with you that we've seen a number of women and babies suffering complications because of what mothers use, especially in the later stages of pregnancy, and then when labor starts, they force the contractions to start. By the way, not only the herbs, not only the alternative medications, there's another drug now that I'm on air to get an opportunity to talk about it, because some people call it emumbu enzungu. There's another drug called misoprostol. Some people now even add it with their concoctions. And they say, just take a full tablet. They just come. Contractions just, you really see a woman almost dying. The next thing, the uterus is about to rupture. Some have actually ruptured. Others, you take to theater because of what we call impending rupture. In most cases, we are able to save the mother and the baby, but with some of those other complications. So dear viewers, there's evidence, we've seen it. This is just a tip of an iceberg because it's just the two of us here, but there are a number of other facilities that have reported this. The only challenge is that whenever those complications occur, the baby or mother are sent to the next level. So the other level may not appreciate the gravity of the matter because the complications will be appreciated from the other side. In addition, some of those herbs cause renal complications. Some cause liver damages, and partly because of the dosage, which is at times not definite. And so we are saying, when it comes to labor, safer you avoid those medications because they may cause certain errors, certain things which are difficult, and some of them have led to loss of life, especially for the newborns, and some mothers have suffered complications like rupture of their womb. And the womb, when it ruptures poorly, at times we are forced to remove it. Right. So they say forewarned is for what? Is forearmed. Indeed. And together we can make a difference. I don't want people to urge out there that our mothers used it, so and so used it. Even those people, some of them used to suffer complications. Right. But you know that even in the past, when someone is in labor, they will say, Kaoneko, Luoneko. It's like you go into this unique battle. Some of them go out with no major complication, but others will suffer complications. But when they do the digging deeper, they say, in some cases, there is a herbal ingestion related to some of the of the complications.
Very interesting. If you come from the school of thought that herbal medicine is healthier and that science has brought about ebyabazungu or the white man mentality and that we are being brainwashed, Well, I think the doctors here are sharing with you the intensity and depth of what happens in there if chance catches that you are a victim to consuming herbal medicines. We are looking at the dangers of using herbal medicine during pregnancies. It's the conversation that we're having. And in case you're just joining, well, you've missed quite a bit of the conversation, but it's never late to engage and learn more of what is left as we use the time that is left. And in studio with us is Dr. Namagembe Imelda and Sister Twinom Salfin, Twinom Hanji Salfin, who are from the Molago Specialized Women and Neonatal Hospital. 0709602592. Ask your question and learn and learn and relearn. Now, Sister Twinom Hanji, why do you think pregnant women actually turn to herbal medicine? In your view, from what you've seen, what do you think causes them to choose herbal medicine in the midst of all the prescribed medicine available?
As we get this local medicine, herbal medicines on board, we should interact with the mothers to understand what is the interest, why are they interested in the herbal medicines as compared to our medicines we do give. They have a number of reasons. One is a belief that their elders, their parents are using them, even up to now, they are using them and they are doing wonders. Two, others believe that now I need to deliver this baby very fast. But when I tell my medical personnel, the one in care of me, will not allow, and yet I have a trip to Dubai. I must go there when I'm delivered, not pregnant. Then they begin the local herbs, initiate the pains to deliver. However, others have said, now, according to our parents, according to our relatives, when I take this local medicine, I will have to have a safe delivery. They will not section me. My bones will soften, the muscles will soften, and the baby will pass through. So that is their belief, and that's what they want. Others want to deliver very fast on the birthday of their husbands, on the birthday of their firstborn. So all that is incorporated in their feeling of starting the local medicines very fast. And another thing, they are very cheap. They are free. They are in their banana plantations. They don't attach a cost.
Right.
Yes, yeah.
Very interesting that the things that we learn, when you think that you are saving yourself, yet in actual sense you're placing yourself in harm's way. Now, let me come to you, Dr. Namagembe. Do you think there should be a regulation to these herbs? Do you think that they should be done away with, or they should rather be regulated as to how they are used?
Thank you so much. Regarding the regulations, of course, there is a regulation related to the alternative medicines, and the issue of being done away with is a relative aspect. But since we need to continuously learn from what is happening, so the purpose of our being here is to inform the viewers, to inform the mothers out there and the husbands, and even the others who are involved in promoting the herbal medication. The issue is to be aware that some of these mothers develop complications. We've seen it. Therefore, when the best, since we are encouraging, we've seen good outcomes when mothers deliver from health facilities.
Right.
In fact, in our country, Uganda, when we use the evidence from the Uganda Demographic Health Survey of 2022, the number of women who are delivering from the health facilities has increased. The outcomes are much better. However, we are still seeing babies who are even at term, who are born at a time when the baby is ready to be out, getting so tired in labor. and the number of things. And here we are, mothers take a number of stuff in their tea, and some of what has been discovered in some cups and flasks and put under tongue are the herbal medications. And the purpose is to strengthen the contractions. Those contractions really increase and become so fast so that, and some mothers have actually delivered very fast. What I want to say that, by the way, some of those herbal medications are really strong. But the issue, we don't know the exact dose. So there's more need for more research. If there's a way of how in future we can quantify, but we are still far. More research is required. For now, based on what we are seeing, we are encouraging mothers, when you come into labor, it is safer to put that herb aside and we monitor labor and see what is happening. Don't give yourself those concoctions, the cups and doses and whatever, and at times we may not even be aware, because some say, you cannot tell the health workers about that until when there are complications. And then the other thing, we are seeing a number of abnormalities with the babies which we cannot explain. In medicine, we are taught the first 3 months of a pregnancy is danger zone. Even as medical workers, when you are prescribing, whether you are prescribing the artificial medication or idagala ly'abazungu, we are very cautious about the first 3 months. So we don't know whether some of those medications in the first 3 months of pregnancy, they could be contributing to some of the challenges we see, because we tend to attribute it to infection. But now we're encouraging mothers, go screen HIV, syphilis, all those kind of things. We do those screening when people, the best is to do it even before pregnancy, even when they come in the first 3 months. But we try to endeavor to encourage to avoid most of the medication, except for the folic acid. The folic acid, there's a certain tablet which we encourage. It would be good to take even for those who have not conceived, as long as you're planning to conceive. It helps to prevent some of the congenital abnormalities. But there are some aspects which are coming on board, we don't know, but in the literature out there, in the research which has been done, exposure to herbal medication has been contributed to some of these bad outcomes. But where I have a lot of evidence is the issues related to the time of labor. Women have had uterine rupture, babies have been born when they are so tired, and they end up going to the NICU, to the neonatal intensive care unit. And when you fall backwards, you realize that there was a herbal medicine injection somewhere in the loop. So we are saying better to avoid.
Now, this conversation definitely has to come to its close, but I would come to you, Sister Twinomhanj. What policies would you recommend to protect women and babies in regards to herbal medicines?
I think as a midwife and having seen these complications occurring because of the herbal medicines, it would be better the country to come out strongly and develop policies against the local medicines in labor to avoid such a complications. Because one, you see, these medicines we have are artificial medicines. Now the recognized one, the NDA approved, they have dosages, you get. And it is said that some of them, the local herbs, we extract some components to develop now, to manufacture the artificial medicines, which we know very well the dosages. Now the fact that these mothers of ours use the other ones where the dosages are not specified, and remember we give the dosages according to ours, according to the number of pregnancies how you have carried. The drugs sometimes they are given by the weight of the patient mother. Now here comes the local herb, where the mother just puts in the cup, the mumba, this soil, clay soil, now keeps on, it's not yet conk, it's not yet conk. Now you take 3 times a day or once in a week, so you just take randomly. The viewers outside there, I would like to say, the medicine that we are taking, we don't know the constitution of the medicine, we don't know how much should we take, how much is dangerous, how much is less, how much is big. Now, if Uganda can come out, the country can come out with strong policies that regulate these drugs. I think we can always have good outcomes in labor. It is painful, very painful, as a hospital, as a medical team who is managing these moms, to get a bad outcome. You see a mother and the whole family coming out with no baby. And the reason is just simple, because of these local hubs. So like for us in Women Specialized Hospital, our targeting, our motto is in the best hands. And when you say best hands, so we need a mother to come out of the best hands, with a baby, with the whole family, happy. And you come back to us after 6 days, 6 weeks, 6 months, as we see your baby thriving very well. So I still encourage the country to come out with the guidelines, the policies that can be better to regulate these local hubs.
All right, thank you very much, Sister Tunomhanji. Dr. Namagembe, your parting shots.
Thank you so much, dear moderator Juliet. Dear viewers, thank you for having created time. We are saying that we are not here to fight. We are just communicating and informing the public that we've seen some dangers, and together we can make a difference. So I believe there can be further discussions, further collaborations, like our friends in the area of alternative medications. Let's have more conversations about these issues. So we are communicating that we are seeing some of the complications as a result of some of these herbal medications. Like what you say, that some mothers have said that, me, I did ABC and it did wonders. But we are saying there are those others we are seeing and are having these complications. And unfortunately, when women are getting these complications, they end up in the hospitals. And in the hospital, when at times it's so late. But we are learning from this. We are seeing these complications, so we are telling the public, please, when the woman is especially in labor, don't take some of those medications, because we've seen that some of them can actually give you very strong contractions, which can make you that uterus rupture within minutes, rupture within a few hours, and at times someone can enter impending rupture in a unit which is already so congested. They cannot even take you to theater there and then because of the so many numbers. So we are saying, let's go in the preventive strategy, because prevention is better than cure. I cannot say that women are dying or getting other complications because of only herbs. There are a number of other things which are trying to look at, to work on from the other angle. But where we have this has been identified, and so let's work together to ensure that we prevent bad outcomes as a result of some of the herbal medication that we see mothers ingesting during the time of labor and at times in pregnancy.
All right, thank you very much, ladies, for having giving us your opportunity and the time to have you. And
maybe this one, akatalekeka,
yes, please,
just may not necessarily because of the herbal medication.
Right.
This is in the area of HIV. Dear mothers, endeavor to screen for HIV before you even conceive. As the couple encourage each other. At a certain time, we had started seeing a better face even with people with HIV. But currently we are seeing some who have defaulted. They are not taking their HIV medication. They are not endeavoring to go in for screening for HIV. And then they come up with those very bad infections. Dear couples, go and screen, especially if you're planning to get pregnant, because it is for the good of you. Some women, once they conceive, the HIV virus just becomes, it goes haywire. So for the purpose of protecting your wife, or for the purpose of protecting the incoming baby, especially if you have interest in conceiving, do the HIV testing. Once tested positive, approach the health workers so that you can be assisted. We are seeing things changing, taking another route, yet we are really grateful that a number of you are really adhering and taking your medication properly, but some others are going into those denial stages, which is very challenging. So part of it, in addition, just using the opportunity.
Indeed. Thank you very much. And indeed, I thank you that you're using this opportunity. It's a very important decision, seeing as we have been performing well, and the goal has been 2030, you know, to have kicked HIV out of Uganda. But thank you so much for watching the show. That's been it for Good Morning Uganda Extra. In studio with me has been Dr. Namagembe Imelda and Sister Tunomhanji Salfin from the Mulago Specialized Women and Neonatal Hospital. And we've been looking at the dangers of using herbal medicines for pregnant women during pregnancies. I think it's best we stay with the doctors for better results ultimately, right? That's it from me. Let's do this again on Good Morning Uganda tomorrow. Have a blessed day. Good morning.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Living a safe